Okay, let's dive into something pretty amazing that might just change how you look at your pantry and your medicine cabinet.
Hmm.
Have you ever thought about where some of our most basic health practices or even everyday foods actually came from?
It's something we often take for granted, right?
Totally. What if I told you that things we rely on today, like, effective wound care, understanding nutrition, or even just taking a bath regularly, have roots in knowledge thousands of years old, developed right here in the Americas?
That's right. We're talking about the sophisticated health and medical practices of American Indian peoples across the Americas.
Practices that were often, well, far ahead of their time compared to what was happening elsewhere.
Absolutely. And that's exactly what this deep dive is all about. We've been digging into the source material, particularly drawing from Medicine and Health by Emory Kyoki and Emory Porterfield. It really shines a light on this incredible, often overlooked history.
Yeah, it does. Our mission here is to unpack the breadth and depth of this knowledge, everything
Mhm.
from nutrition and hygiene.
To complex surgical techniques and a truly holistic approach to healing mind, body, spirit, the whole picture.
Exactly. We want to highlight specific examples, understand the context, and also, sadly, how some of it was impacted or even lost over time. Think of it as, uncovering this rich, innovative history that still impacts us.
Definitely. So, where should we start? Maybe with that foundation of wellness before widespread European contact.
Good idea. The source material really emphasizes the generally good health of many American Indian groups back then.
It does, and it contrasts this quite sharply with health conditions in Europe at the time. A major factor was, unsurprisingly, their understanding of diet and nutrition.
The nutritional wisdom sounds pretty remarkable. The source notes hunters and gatherers, especially along coasts or on the Great Plains, were among the healthiest people in the world.
It even mentions Lakota men on the Great Plains in the late 1800s were, on average, taller than American and European men.
Taller. Wow.
Yeah, and height is a strong indicator of nutritional health during development, so that's a powerful stat right there.
That is fascinating. And their protein sources were varied mammoth back then than bison, deer, elk, fish, birds.
But one of the key insights from the source is how they often utilize the entire animal. Organ meats, marrow.
Right. Not just the muscle meat like we often think of.
Exactly. Internal organs are incredibly high in essential nutrients, things like B vitamins, iron from marrow. Niacin, for example, found in organs, is crucial for circulation, energy, nutrient absorption. They knew instinctively this stuff was vital.
Long before we isolated specific vitamins in labs.
Precisely, way more nutrient dense. And then you add the plant foods for crucial fiber.
Fiber, yeah. We hear about it constantly now, digestion, cholesterol, blood sugar.
And they were getting vitamins and minerals from sources that might surprise you. Vitamin C from berries, sure, but also chilies, incredibly high in C.
Chilies, really?
Yep. And calcium from things like cholla cactus buds or juniper ash. The source compares a tablespoon of cholla buds having the same calcium as an 8-ounce glass of milk.
Whoa. Okay, that puts a different perspective on dairy.
It does. And they understood iodine too. Kelp, fish eggs, sea salt, preventing things like goiter. They had this deep knowledge of their environment.
Which brings us to that,
Yeah.
that really mind-blowing innovation you mentioned earlier. Something that solved a major health problem.
Ah, yes. Pellagra.
That nasty deficiency disease.
Yeah.
Skin issues, digestion problems.
Yeah.
A huge problem in Europe, Africa, parts of the U.S., where corn became a staple.
Exactly. Because corn, while great, has a form of niacin that isn't easily absorbed by the body. So if it's your main food and not processed right, pellagra.
But American Indian peoples who relied on corn, like the Aztec and Maya, they figured out this process, nixtamalization.
Nixtamalization, that was the key. Soaking the dried corn kernels in lime water, calcium hydroxide, or water with wood ash.
And that simple step,
What did it do?
it unlocked the bound niacin, made it absorbable, completely prevented pellagra, plus it slowed down starch digestion, helped regulate blood sugar.
And the shocking part is, when Europeans adopted corn, they missed this crucial step. Initially, yes, they took the corn, but not the processing knowledge, leading to widespread pellagra deaths where corn became the staple.
And it wasn't until, what, the early 20th century?
1914, yeah. Western scientists independently rediscovered the importance of this process thousands of years after American Indians had already solved it.
Wow. That just speaks volumes about their accumulated wisdom.
It really does. And speaking of valuable foods, the source points out several American Indian crops we now call superfoods.
Right, stuff you see everywhere now, amaranth.
A complete protein, lysine, Quinoa from the Andes, another complete protein powerhouse, high in minerals. Chia, used for energy by ancient travelers. Omega-3s,
Chilies, again, not just spice, but vitamins A, C, antioxidants like lycopene.
which the source links to potential colon cancer reduction. Even blue-green algae, spirulina, harvested by the Aztec, incredibly high protein.
These foods are global staples now. It shows that profound contribution to worldwide health.
Definitely. And beyond diet, their physical fitness was astounding. Early Europeans were constantly writing about it.
Like Cabeza de Vaca, right? Seen Texas Indians running after deer all day without tiring.
Exactly. And the Aztec described as skillful, robust, tireless. There's that anecdote of Sharp Shins, a Blackfoot man, supposedly running 90 miles in a day.
90 miles. That's incredible.
That level of activity fits perfectly with what we know now about exercise benefits, blood pressure, heart disease, diabetes. They were living it.
It really makes you think, doesn't it? How many of these ancient superfoods are staples in your diet now? And how much our idea of a healthy lifestyle echoes this ancient knowledge?
Okay, so moving from what went into the body, how about keeping clean? Themselves and their communities, another area where practices were often way ahead.
The bathing habits alone are eye-opening, especially compared to Europe back then.
Right. The source talks about frequent bathing lakes, streams, rivers, hot springs, sweat lodges across many tribes.
You compare that to Queen Isabel of Spain supposedly taking only 2 baths in her entire life.
It's hard to even imagine. Conquistadors were genuinely astonished. Andres de Tapia noted Montezuma washed twice a day. Pizarro was impressed by Inca bathhouses.
With plumbing.
Sophisticated plumbing, hot and cold water piped in copper, spouts, drains, shelves, at a time when chamber pots were the norm in Europe.
Amazing. And hot springs weren't just for cleaning.
No, they were healing centers for physical health, spiritual purification. Places we know today, Saratoga Springs, Calistoga, Hot Springs National Park, used for millennia by American Indians for their mineral waters.
Sometimes neutral ground even for warring tribes.
That's right. Later, colonists turned them into resorts, but the original understanding was indigenous.
In the sweat lodges. Or steam baths like the Aztec Temazcal.
Used for detoxification, sweating it out, improving circulation, relieving congestion, easing muscle and joint pain, even used to help ease childbirth.
Did they add things to the steam?
Often, yeah. Medicinal herbs on the hot rocks, so you get aromatherapy, therapeutic vapors. The source tells that story of William Bratton.
From Lewis and Clark.
Right. Severely ill, back pain, rheumatism. He recovered after repeated sweat lodge treatments and mint tea. A great practical example.
And they had natural soaps, too.
Yeah, plant-based cleaners. Plants with saponin acted as natural detergents for skin, hair, clothes.
Saponin, like in quinoa.
Exactly. And these plant detergents often worked better than animal fat soaps, especially in hard water. They lathered well, didn't leave scum. Soap plant bulbs, wild gourd for laundry.
And personal care beyond cleaning.
Yep.
Conditioners. Skin treatments.
Purified animal fat, sunflower oil, or jojoba as conditioners. Jojoba is actually a liquid wax, doesn't go rancid. Still used in cosmetics today.
I think I've seen that on labels. And agave gel for sunburns, like aloe vera.
Similar idea, yeah. Plus, insect control was part of hygiene. Plant-based remedies for lice, sweet root, wild onion. Methods for repelling pests.
Like what?
Burning certain plants, using crushed mint, placing strong-smelling things like chilies in storage. Aztec barbershops kept hair short, partly to discourage insects.
Practical. And what about community sanitation, beyond personal hygiene?
Another area of remarkable advancement. In North America, careful waste disposal away from water sources. Basic, but crucial.
But in Mesoamerica and South America,
Yeah.
more complex systems.
Oh, yeah. The Olmec had sophisticated plumbing U-shaped blocks, making covered sewage systems. The Inca used copper pipes for hot and cold water to bathhouses and for drainage.
Again, compare that to European colonial practices. Chamber pots in the street, outhouses near wells.
Big difference. And the cleanliness of cities like Tenochtitlan, the Aztec capital, astonished the Spanish. The source mentions dedicated street sweepers who not only swept, but washed the streets.
Washing the streets.
Shows a deep understanding of public health, doesn't it?
It really makes you pause. Your daily shower, laundry detergent, basic sanitation, how fundamental these are and how their origins might trace back way further than we assume to this ancient American wisdom.
Okay, so shifting gears again. From prevention and cleanliness to active healing, plant medicine, surgery, wound care, the knowledge here is just incredible.
The sheer pharmacopoeia they had. It's astounding. The source highlights this vast knowledge of medicinal plants, but also the understanding of toxicity. knowing what needed careful handling.
And this plant knowledge had a huge global impact. Think of Echinacea coneflower used by Plains tribes for immunity, infections. It's everywhere today.
Or witch hazel,
Yeah,
still in my bathroom cabinet. Used as an astringent, adopted by colonists.
exactly. In Mesoamerica, arroyo willow contains salicin, the active ingredient in aspirin used for fever and pain.
Aspirin, from willow bark.
Yep. And chili peppers, again, not just food, but used topically for pain. Capsaicin, the hot compound, is in modern pain relief creams for arthritis, nerve pain.
Huh, never thought of that connection.
And in South America, quinine from cinchona bark, the only effective malaria treatment for centuries, saved countless lives.
White on water, right. Gin and tonic history there.
Right. And coca leaves as a local anesthetic for energy. Curare as a muscle relaxant, even used in surgery later on.
It wasn't just random folklore, was it? The source mentions Montezuma's botanical gardens for medicinal plants.
And an Aztec plant classification system centuries before Linnaeus in Europe. It was systematic observation and knowledge.
Okay, beyond plants. Surgery. This sounds almost unbelievable for the time.
The skills were remarkably advanced. Controlling bleeding, using anesthetics, even principles of asepsis sterile practices long before germ theory was accepted in Europe.
Asepsis. Wow, what kind of operations?
Routine stuff like removing skin growths, sure, but also complex things, draining fluid from the chest, skin grafts from the scalp, fixing torn ears, facial plastic surgery, reattaching noses, even making artificial ones.
Artificial noses.
Yeah.
Good grief. And cataract surgery.
Yes. Aztec doctors removing clouded lenses with tiny, incredibly sharp obsidian scalpels.
That takes insane precision even now. And trephination, drilling holes in the skull.
Performed for thousands of years. Paracas in Peru 3,000 years ago, Olmec, Maya, others.
Why? What was the purpose?
Various reasons proposed: releasing pressure, spiritual reasons, treating head injuries. The source describes the process. Anesthetics, cutting scalp flaps, working through the skull with stone tools.
Stone tools for brain surgery.
Controlling bleeding with hot rocks. Covering the hole afterward with gourd or gold foil while bone healed. And the source suggests surprisingly high survival rates. High skill level.
What about the tools themselves? Obsidian scalpels.
Microsharp. Literally molecule-thin edge. Finer than modern steel scalpels, causing less cell tearing, maybe quicker healing. Only modern lasers compare for precision.
So ancient tech sometimes outperformed later metal tools in some ways.
In terms of edge fineness, potentially yes. They also used copper and silver scalpels sometimes, and the Maya used bow drills for dentistry.
And pain control. Anesthetics.
Effective plant-based ones like peyote, jimson weed, datura. Stark contrast to Europe before the mid-1800s, hitting patients, potentially fatal doses of alcohol or opium. Whiskey marketed for medical use.
Yikes. And infection prevention.
Antiseptics. Plant-based ones, yes, but also, crucially, boiling water to clean wounds. Simple, effective, centuries before germ theory was widespread in Europe.
And general wound care.
Thorough. Debridement, cleaning out foreign matter. Clean bandages changed daily. Packing wounds with eagle down, puffball fungi, spider webs. Flushing with syringes.
That's just remarkable. The sophistication without modern tech.
Huh.
The skill, the precision. Cataract surgery. Trephination. Mind-boggling.
And it wasn't just about the physical body. Many cultures had this deeply holistic view of health.
Right. Illness affected mind, body, and spirit. And the community was involved.
Which contrasts sharply with early European physicians often dismissing the spiritual or emotional side.
But that mind-body connection. Modern science totally backs that up now, right?
Absolutely. The source mentions how stress hormones like cortisol weaken the immune system, contribute to heart attacks, diabetes, make you more susceptible to illness.
While relaxation, positive emotions boost immune function, lower blood pressure. They knew this intuitively.
They did. And many cultures practice forms of psychotherapy, talking cures.
Like the Aztec physicians asking about life circumstances if physical treatments failed, using bathing or ceremonies for emotional cleansing.
Exactly. Or the Iroquois and Huron belief that unexpressed feelings or needs, often revealed in dreams, caused illness.
So dream interpretation was part of diagnosis.
For many, yes. Huron, Iroquois, Cherokee, Northwest cultures, Inuit, Plains tribes, understanding the soul's desires to guide cures, often through community ceremonies or feasts to restore balance.
And the healing power of stories.
Crucial in oral cultures. Patients sharing dream stories, healers telling traditional narratives. It connects to modern narrative therapy, making sense of experience, finding meaning, changing the story to cope.
And the role of relationships. Family, community.
Seen as absolutely vital. Illness affected the whole family. Support from loved ones, the community, was understood to aid recovery.
Which modern research strongly supports, too. Strong social networks lead to longer, healthier lives.
And the community cared for the sick person's family, the elderly, those with disabilities, a collective responsibility.
We also mentioned aromatherapy earlier with sweat lodges.
Right. Using scents like sage, sweetgrass, cedar for purification, but also recognizing their effect on mood. Aztec fragrant gardens use smells to relieve depression or tiredness,
And the ceremonies themselves, songs, dances, prayers.
central to spiritual healing. Using symbols like a dancer representing disease transforming into wellness helped the patient visualize healing.
Visualization.
Hmm.
Another thing modern studies show can impact physical metrics, reduce anxiety, pain, maybe speed healing.
Even boost immune function. It
Mhm.
seems ancient wisdom anticipated so much of this.
There was also that specific practice around childbirth,
Ah, yes. Isolating mothers and newborns, assigning a dedicated caregiver.
which prevented.
Contagious disease, especially childbed fever, common and deadly in Europe then, but rare among American Indian women following these traditions. A practical understanding of infection control.
It's powerful, connecting mindset, relationships, community, visualization, all anticipated by this ancient wisdom.
But as we look back on these incredible innovations, we also have to talk about the legacy and the history of loss that followed European contact.
Yeah. The source reminds us first of that huge contribution. American Indian farmers developed 3 out of every 4 food crops grown globally today.
An immense impact on world nutrition,
Yeah.
undeniable.
However, colonization brought devastating changes, especially forced dietary changes. Land loss meant no access to traditional hunting, gathering, farming.
And government rations introduced non-traditional foods. Unprocessed corn leading to pellagra. Low-fiber, high-sugar white flour, refined sugar, causing tooth decay, diabetes.
Pressure to drink cow's milk despite widespread lactose intolerance. Destruction of traditional food plants.
All of it. These forced shifts away from diverse, nutrient-rich traditional diets are directly linked by the source material to the disproportionately high rates of type 2 diabetes, heart disease we see today among American Indians.
Such a tragic irony. The originators of so much global nutritional wealth suffering such consequences.
It is. Yet despite the immense challenges, disease, displacement, disruption of knowledge, many traditional practices and plant knowledge have persisted. They're being revitalized.
And figures like Charles Alexander Eastman Ohayesa, he bridges that gap, right?
He does. First American Indian physician trained in a non-Indian medical school. Traditional upbringing, worked as a doctor treating wounded knee survivors, became a powerful advocate.
He saw the value in both Western medicine and traditional healing.
Yes. He appreciated the spiritual side of indigenous practices, believed maintaining cultural identity was vital. His life reflects that complex legacy, huge contributions, devastating impacts. It underscores the value of preserving and learning from diverse traditions.
So, wrapping up, this deep dive has shown this incredibly sophisticated history. Nutrition, hygiene, surgery, plant medicine, that holistic mind-body community approach.
A history of innovation, centuries ahead in many ways, that still informs modern health and wellness, often without getting the credit.
Right. Given the depth and effectiveness of these ancient American Indian health practices, it leaves you with a thought, doesn't it?
Definitely.
What other lessons might be waiting to be rediscovered from indigenous cultures around the world that could profoundly benefit modern medicine and our understanding of well-being?